how would you say that you would know that the symptoms are severe enough to go see a gastroenterologist? Like, at what time would you say the patient should come and see their doctor? What symptoms would that point out to?
It's a good question. We are looking for things like what we call as alarm symptoms as such, wherein we see that the onset of symptoms is relatively late in life. It's associated with other problems like difficulty swallowing, weight loss. If somebody has been a smoker for a long period of time, and they also have family history of cancer, stuff like that, those should prompt a more thorough investigation, a more thorough evaluation. It's, I think, at that point. And also, many a times, what happens is people are self medicating themselves. Right now, acid reflux medications like antacids and PPI therapies, they're all available over the counter. So people end up using them. And once the patient has been using these kind of agents for some period of time and they're not feeling the benefit from it, that should prompt you um, to get an evaluation by a GI physician, because it could be something else or it could be just more advanced disease than what it is seemingly there.
Doctor, can you break down GERD for us? Like, can you explain to us what it is and what the prognosis looks like and what we usually see and how we can rule out somebody with GERD?
It's a very very common problem with massive medical costs, and it's present in all patient populations, even from childhood all the way to old people. You know, it's basically defined as the abnormal presence of acid, excessive presence of acid coming from your stomach going into your food pipe, causing symptoms of heartburn and burning, etc. That's what the GERD is defined as, and it can lead to a lot of problems. It's not just the presence of acid, but it is the damage that is caused by the acid is causing the symptoms too. Here in the Western Hemisphere, GERD is a big problem, and it's been shown that it can proceed and progress towards permanent damage to the lower part of your food pipe. It's a condition called Barrett's esophagus. It's a complication of GERD. Like that, other complications can also happen by this acid-induced damage in your food pipe that can cause things like reflux esophagitis, strictures. And when you have Barrett's esophagus, you are at a higher risk of developing esophageal cancer too. So it's been shown that amongst all the other cancers, the fastest growing cancer in the Western Hemisphere, specifically US, is actually the GERD-induced Barrett's esophagus-related adenocarcinoma. So it's a serious condition if ignored. So if we identify the problem, the best thing would be to intervene early, treat the condition, so that we can prevent these
And what
complications.
does the treatment for GERD look like, doctor?
Right now, right off the bat, it's a sequence of treatment map that we see. Uh, let's say any regular person like you and me, we develop heartburn. What we try to do is we try to modify our diet. We try to eat less of spicy foods that can make your symptoms worse. We then start using over-the-counter medications like antacids. We start using medications like Pepsid, or we start using medications like omeprazole, pantoprazole, things like that. And once we start using them, we see some benefit. Majority of the patients are relegated to medical management, which means that we are treating them with medicines. The usually common class of medications is the one I just mentioned to you. We treat those. There are a couple of new developments. So there's a new class of medication that have come out. They also are basically the potassium channel blockers that help in reducing the acid content of your stomach. They reduce the acid production, which is a response to your meals, and even the basic. There's a level of acid production going on as a basal rate. That also seemingly is reduced by these medications. So first of all, we try diet, then we go on to these medications, and we sequentially build up on these medications. If one class of medication is not working, and then slowly we build up and we proceed towards full dose, things like that. Now, in a select subset of patients wherein we are seeing that these medications are not actually fully effective, then we proceed towards non-medical treatments. There are a couple of endoscopic therapies now that are being tried here in the US. One is the magnetic device, wherein we put a ring of magnets around the food pipe, which actually augments the sphincter that controls the 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 entry of acid into the food pipe. So that has become loose. We try to alter that by doing a magnetic augmentation, which is like a ring that helps in the closure of the sphincter. The other modality is called a TIF procedure, which is an endoscopic procedure. We go in and we do a fundoplication all with endoscopy. And beyond this, the other option left on the table would be the surgeries. In the surgical strata, we think of doing like a toupee procedure, a fundoplication, all of which is basically aiming towards reduction of the acid coming into your food pipe by strengthening your ring muscle, which is your sphincter, right at the end of your food pipe, just above the stomach.
And doctor, do you find that like stress or anxiety usually triggers GERD?
Yes, there's lots of condition that actually affect your symptoms of heartburn and GERD. There's a long list actually. Things like lack of sleep, different dietary habits, horizontal positioning right after meals, all these conditions, other medications, your gastric emptying times, your salivary secretions, all of these can affect ultimately how and what happens in your food pipe and your gastric situation. Stress is one of them. If stress causes anxiety, lack of sleep, it again leads to increased sensation, increased perception of the underlying damage and the inflammation.
And doctor, for people suffering with acid reflux at night, would you say that there's a particular position that you'd recommend for them to sleep in?
Well, it's been shown that the left lateral decubitus position, which is sleeping on your left side, it leads to a little less exposure of acid coming into your food pipe, because what happens during nighttime is usually your stomach's full. The habits of people mostly are towards the end of the day, they have a dinner, which actually most of the times is the heaviest meal of the day, which is not the best thing, right? So when the stomach is full, when you lie down, the angulation of the food pipe in the stomach, in the left side, it actually decreases the reflux actually, because the left side of your body, your stomach's more prone towards the left side. The fundus of the stomach, which is the biggest part of the stomach, is more towards the left side of the body. So when you lie down on your left side, the food tends to get accommodated over there and comes back up less. Whereas compared to the right side, there has been studies which have proven that the amount of reflux coming into your food pipe is relatively much less in the right position as compared to the left.
And doctor, do you find that GERD in some cases does cause sore throat or coughing without the heartburn symptoms?
Yes. So these are called the extraesophageal manifestations, other than your regular typical symptoms of heartburn and cough. Sorry, heartburn and regurgitation. Other symptoms that can affect your upper part of the pharynx and your common tract between the breathing tract, that can cause irritation all the way up to the larynx as well. Something that is very common and it's underappreciated. It's called laryngopharyngeal reflux, right? So what we are telling is that the acid is coming all the way up and is going into your larynx area and irritating it. So that can cause symptoms like throat clearing, wheezing, sore throat, cough. All these can be part of the GERD complex, and these are known as the extraesophageal manifestations.
Mhm. Mhm. Thank you so much for breaking that down for us, doctor. And to everyone watching, if you have any more questions that you would like for Dr. Asad to address, please put them down in the comment box and we'll get to them as soon as we can. Thank you so much, doctor.